Cold pack, check off. Today we're dealing with a patient post rotator cuff surgery. Why a cold pack? The cold pack is going to help with the pain management. It's going to offer an alternate stimulus, targeting C3, C4 via gate theory. All right, so prior to any cryo, we're going to have to do a sensation test. This is going to be cold and this is going to be hot. So this is my patient's shoulder. Prior to beginning anything, I want to look at the area and make sure that everything is, nothing is abnormal. Yes, we're going to see the incision for the rotator cuff surgery, but I see nothing else abnormal, no open wounds. Basically, any area that we're going to be targeting, placing a cold pack over, we want there to be nothing abnormal there. So what this would do is, with a cold test tube and a hot test tube, I'm going to be hitting that area 3 different times. I'm going to ask for the patient's feedback and let me know if this is hot, cold. If I place cold and he says hot, then that's -1. We're going to do this 3 different times. In this case, the patient was accurate 3 out of 3. So he is intact. So that gives me the go ahead and start with cryotherapy. So with the cold pack, what I'm going to do is, this is a towel, a damp towel, and I'm going to be placing the cold pack inside and proximal to the incision. The patient has no history of hypertension. Upon looking at his medical record, they have no history of Raynaud's disease and no hypersensitivity to cold. So we're going to go ahead and place this on the area. The patient, or the cold pack is going to last. It's going to be on the patient for about 10 to 20 minutes. So in those 10 to 20 minutes, I'm going to be working with other patients as well. So I'm going to offer the patient a bell. The bell is used to offer the patient the ability to call us if they need assistance. Regardless though, I'm going to come back and check on them. While this is going on, I'm going to ask for feedback. How does that feel? They're going to be going through the 5 stages of cold cryotherapy. So that's normal. But if there's any adverse effects, like a burning sensation, then I would stop treatment immediately. So the same way I did prior to treatment, checking the area, looking for any anything visibly disturbing, I guess. I'm going to take this out, and same thing. I'm going to look if there's any adverse effects on the shoulder. It's going to be normal to look maybe a little bit pink, a little red, but there should be no abnormal discoloration in that area. And if everything's a-okay, we're good to go, and we could probably do cryotherapy next session. I think that's all.